Hello, everybody. I think we are live. You probably need to move that back, way back. Yeah, if possible. And probably up a little bit. I don't know. Hi, everyone. I am Dr. Rahi Victory. Welcome to Fertility Fact or Fiction, our weekly show where we share all the greatest information about fertility with you when there is great information to share. Tonight, there is very little great information to share other than I want to kind of talk and invite lots of comments from you guys about what you guys think about the post we had on Instagram where they did the maternal spindle transfer in Fertility and Sterility Journal. So basically, as I understand it, they took the nucleus from one patient who was older or had failed IVF before, and they transferred it to the cytoplasm and cell of a woman that was younger as an egg donor, and then they took that mixed egg and they put that into either the intended parent or somebody else to get them to be the gestational carrier. And they had a low number of overall successes, but the question is this something we should be doing? So this is basically three-party IVF. So you've got not just an egg donor and a sperm source and a surrogate or gestational carrier, whoever that may be, but you've actually created a baby from three different sources. So nature only allows us to do it with two. This is science really overstepping to see if we can improve things for people. So we don't know the side effects. They claim that the children had done well, but it's a very interesting case. So I want feedback from you guys. Put up your comments right now. What do you think of making a baby with three genetic sources to the baby? So this isn't just having a surrogate involved, but this is actually three separate genetic sources. So I want to know what you guys think about that. We got a screen share too, by the way. Oh yeah, there you go. So tell me what you guys think. I am very keen to hear opinions. I put up a poll, and I think 68 or 69% at the end said they approved, which I was kind of impressed by. And the remainder obviously said that they didn't. So I want to hear from everybody. YouTube, TikTok, Instagram, Facebook, Twitter. What do you guys think about making a baby from three different genetic sources? That is our very brief topic for tonight, and I will happily handle all of the comments that come up. What do you guys think? Would you be willing to do this? How would you feel about the child if the child was made from three different sources? What if things goes, sideways on us later on and we find out these kids have problems that we never even anticipated? Or what if when they go to reproduce, they have problems? I don't know what the answer is to this one. Nah, bro, I'm not sharing my baby. That's one of the topics. That's good. I mean, that's what I'm looking for. I want to know what you guys think. What do you guys think about this? Would you create a baby using your sperm if you're a person with sperm? We got to be careful these days. I can't say guy anymore. If you're a person with sperm and you create a baby with a woman who is your partner, who makes eggs, but the eggs are not great, so they take her DNA and they put it into somebody else's cell who has good cytoplasm and mitochondria and all those things we need to make it all work well. My nut, my baby.
All kinds.
I love it. That's from Hachachin. That's not quite the comments I was looking for, dude. But I love it. It's good. What about everybody else? Anyone else?
Yeah, on Instagram, go on. That's just wrong. LOL. I don't think that it's morally right. If the babies are really not having any side effects, then that's fine. It's the same as getting a donor egg to me.
Oh, that's interesting. See, I don't know. What do you think?
There's a lot going on in that question. That is a loaded question.
It's a loaded question. I know. It's crazy. I don't know what the right answer is. It isn't donor egg. Donor egg has two genetic sources. You've got the genetics of your egg donor, and you've got the genetics of your sperm source, and those are the only two that are going to make the baby. But this actually has three people involved in making the baby.
It's a lot. But you know what? For those,
it's a lot.
Who do you blame if something goes wrong?
Well, that's my question. Who do we blame if something goes wrong?
You know what I mean? Now it's three. Three could be a crowd sometimes.
I don't know. Who's responsible? What do we do? What do we do if it goes sideways?
I get concerned with how you explain this to the child more than anything. That could be very confusing for a child.
Yeah. Who's your mom? Who is your mom? Is it the genetic mom, which contributed the nucleus, or was it the egg donor mom? Like
oh yeah, that's serious.
You got 3 parents all of a sudden.
Oh, that's too many.
This is the first time in history.
There's no cartoon storybook that can explain this one.
I don't know what the right answer is. This is interesting. I want people on TikTok, because they're quite lively on TikTok, and everybody else, YouTube, Facebook, Instagram, Twitter.
Don't be shy.
Don't be shy. Throw out your thoughts. We will read them out loud. Let us know what your thoughts are. Would you accept? The question is that scientists in the UK have created a baby using basically the cytoplasm from one person, so the cell structure and everything from an egg donor, so it's got lots of strong mitochondria and all the elements that are needed in it. The DNA from another woman who produces the chromosomal components that are going to lead to the actual genetics of the baby, and then the sperm from a third person. So there are 3 people involved. What are your thoughts? I would love to hear what everybody's thoughts are, because this is a first time, and I want to know what people think. Absolutely not. We got Tal on TikTok saying absolutely not. No. See, this is interesting on TikTok, because I asked this question in a post on Instagram, and over 2/3 of the people that read it said, yeah, they had no problem with this. I don't even want to say where I am, but
because it's interesting. TikTok is going to get a giant sample of a general populace.
I know TikTok
right?
is,
and your Instagram is like the IVF crew. Yeah, absolutely.
Yeah. I know. There would be so many legal issues with that, surely. Well, not in the UK, and it's apparently being done in Mexico and one other place. I don't know that any of that would be safe, but I'm super keen to hear what you all think. What would you do if you had the opportunity? You tried multiple cycles of IVF on your own. It didn't work. I turned to you, and I'm not going to do this, but I turned to you hypothetically, and I said, look, I can help you. We're going to take your nucleus. We're going to pop the nucleus from your egg cell, into another woman's egg and remove her nucleus, and we're going to create a baby with 3 people. There's just too much left to question and what ifs.
On Instagram.
I agree. Tal said, I'm in the UK.
Oh, man. Oh, man.
Well, Tal, thank you for staying up to 1 a.m. to watch our show. So that's awesome of you. Oh, I mean, if I couldn't have my own biological child. Oh, see? She changes it.
It changes when
she couldn't have her own.
Yeah, I really do believe a lot of these are circumstantial questions.
Yeah, it's
when your eggs are fully powerful and your sperm is full speed ahead.
Yeah.
No.
Right.
But when your eggs not so good and your sperm's not so fast.
Then it changes everything.
I think it changes. I think it does.
I don't know what the answer is, guys. I think it's interesting. I think this would be awesome for same-sex couples. So it doesn't necessarily apply for same-sex couples, but interesting. Heather says, "Nah, I wouldn't do that." Any more people on here?
Oh, on Instagram, yeah, of course. So I get concerned of how. Oh, I read that one. I think of it like donor egg, but just taking the mitochondria. But what you just said, I'm worried about future effects that aren't anticipated yet. Another one is, it's the same as a donor egg. Mitochondrial DNA would be the only difference.
Yeah, but now we've created a baby with 3 people.
If this was my only chance of conceiving a genetically related child, I would 100% do it.
Isn't that amazing?
And the good thing is that we would be able to perform all the compatibility test stuff between these 3 people.
Well, actually,
sign me up, I'll do it, someone even says.
So I can't wrap my head around that. I'm also a nurse though, so.
Oh, interesting. ...
And I have another one that says, I would have my biological child or none at all.
Oh, interesting.
Hardcore. Yeah, nothing wrong with that. There's nothing wrong with that. I get that from a lot of people. It's an interesting question. I don't know what the right answer is. Again, I have no idea.
The lady in the UK,
how
she's
far
saying
should we go?
The lady in the UK, she's saying that she's starting her conception journey right now.
Oh.
And you pop up on her For You page.
Oh, that's awesome.
You're
in
the
the
official
UK.
guy.
Dude, that's wicked. We are the UK people. I love it.
Can I do a FET right? Oh, no, that's a different question.
You got to contact us. We're actually looking at coming to the UK soon.
That's true.
So I'm working on it, yeah.
How much DNA is in the mitochondria?
Not a lot of DNA because it's only the DNA for the mitochondria. So it only programs the mitochondrial DNA, not the rest of anything. Yeah. Super, super, super interesting. Give us your feedback, guys. Ask everyone you know, invite them onto this discussion. I want to know what you think about creating a child out of 3 people. It's an interesting thing. I mean, we've got the science part and we got the ethics part. And then the ethics part breaks down into how do the parents feel about this? How does society feel about this? And like someone mentioned earlier, what do we tell the kid? Who is your mom? If you had an egg donor and you had a nuclear source for the chromosomes, is the chromosome source the biological mother? Is the egg source the biological mother? I don't know.
What about in the future?
2 parents are enough.
2 parents are a lot.
Yeah, I grew up with 4 parents because my mom and my aunt are sisters.
That definitely requires explaining.
Yeah,
for sure.
I know. So my mom and my aunt are sisters, and my dad and my uncle are brothers. So 2 brothers married 2 sisters, and my aunt and uncle never had kids of their own, so we were their kids. But they were all my parents, basically, because we all lived together forever. So I literally have 4 parents, 2 moms, 2 dads. And I love them all equally. They're amazing people. And I wouldn't be who I am without all that wonderful support and love growing up. But I get what they're saying. This is very, very, very different.
They're asking, do you know how much this costs in the UK?
Not a clue. I don't think it cost anything. It was a research project. Yeah, it's published in Fertility and Sterility in their current issue. I don't know. I don't know. It's a super interesting question. I mean, I do not know what the right answer is, but I love, we got to figure out how to do an online poll again and having lots of people here. Yeah.
I say go for it. I'm sure physicians and psychologists had similar discussions like this when first introducing IVF and how controversial it seemed initially. Science is incredible.
Science is incredible. I will give you that. And we do try a lot of different things. Back when the technology came out to try the let's harvest mitochondria from mitochondrial stem cells in the ovary and transplant them into, the ICSI process to improve the outcome. I tried it. I forget the name of that company now. Forgive me. They raised like $150 million, became this big thing, and then everybody realized it doesn't work and it's gone. And there was actually one particular physician in Toronto who got all sorts of press for doing it and was charging people like 10 grand a pop to do this. It was useless. It was completely useless. So I am very, very hesitant to jump into stuff where there's no proof. The interesting thing about this study, they had, I think, 27 or 29 people who actually did it, and there were only 6 babies born from it. So it's only like a quarter of them that work, too.
Doesn't all work.
I don't know.
So it would be equally 3 people. I would be mostly the DNA of the sperm and nucleus and a tiny bit from the mitochondrial donor.
Yeah, that's right. Yeah, it would be mostly DNA of the sperm, the person providing the nucleus, and then a little bit of DNA from the mitochondria. So Tal says, I mean, I bet people questioned IVF when it first came around, so I'm always interested in the future. And then Heather says, I couldn't do IVF. Katie, Heather, and Tal have become fast friends on TikTok.
I see that. So it's
Awesome.
a relationship builder.
Why not try? Oh, here's Hutchichin. Why not try solving the issue with eggs and sperm instead of doing that? Because some women, despite trying everything, can't solve the problem with the eggs. They tried multiple times. These were people, all of whom had failed multiple previous cycles of IVF. And because they had failed, they had to turn to something different. So, yeah, it's an interesting question. Yeah. Any other comments there? TikTok, YouTube?
I would say to my child that I wanted you so much, I had to ask for help to make you, and someone let me borrow their cell to help me make you. I would be sure to tell my child it was out of love.
Aw, I love that. That's great. Who said that?
Somebody. Make it work.
That's awesome. I love that.
Yeah.
Unexplained infertility is a thing. You can't always just fix something, unfortunately. Yes, that's true. We have a whole video on YouTube dedicated to unexplained infertility, which has taken off recently. I don't know if you noticed that.
I didn't notice that.
It's huge now. So that'll probably be our next big video.
Yeah, sure.
Yeah, it's running up the numbers.
What about just adopting someone?
Yeah, I mean,
that's what someone says.
Hey, look, I'm all for it. Yeah, Hachichin said it too. Just adopt someone. And then Tal says adoption in the UK is very hard.
Yeah, like in Canada.
Canada, it's brutal to adopt a child. You're either getting a child from Children's Aid Society, which, can have lots of problems, or you're waiting forever. So I don't know. I would love to figure this one out and see what the right answer is. We need like a mass population vote. I don't know how to do that, but we got to figure that one out for sure. If you haven't been there and dealt with infertility, adoption isn't always the same answer. See, we got people on like every side of this equation. I love it. It's a good discussion.
I think parents would explain it to the... Oh, yeah, I read that. I feel like it's an interesting option if it was the last resort and you still wanted to feel like they had some of your DNA, but I can't say I'd do it myself. It's a tough question.
So Heather then says, I wouldn't technically consider the child to be 100% mine unless it was from me and my partner. I will say, okay, I am going to comment on that one. Love the input, and thank you for putting that in there. I will say that the parents of children that have used donor eggs or donor sperm love those children every bit as much as they would if they were biologically theirs. So I don't know that that part makes that much of a difference. But the fact that this kid is made of 3... or maybe kind of 2.5, I mean, how does that change things, right? Like, genetically, the child is still yours. So, how does that...
Is it 100% genetically yours? Like, is that egg... Like if you take a normal egg, and you take the egg that has the DNA from the other, like you use your egg...
Yeah.
Are those two eggs exactly the same?
Everything but the mitochondria.
Yeah, well, what's the impact of mitochondria on a person? Like
energy efficiency of the cell. That's it.
So yeah, but how does that translate into making a human?
I don't know. I mean, it might have something to do with the mechanism and the machinery and how things work down the line. I mean, the human body is so complicated. There are billions and billions of processes going on all the time. Yeah. So Katie says also adoption can end just as tragically. I have had a failed adoption and it was tragic.
Really?
See, there's so many sides to this.
A lot of nuances.
Yeah. Tal says, I find adoption to be stupidly expensive. Tal, I totally agree. In Canada, it's stupidly expensive too. And these are people that are trying to help children in need, and it's still ridiculous.
It's expensive?
Oh my God, it's psychotic. It's more expensive than doing IVF. It's cheaper to make a baby from IVF than it is to adopt a baby.
Really?
Yeah. Yeah.
Huh. I never would have assumed that.
No, it's crazy. Yeah.
This is so amazing. What a wonderful and exciting new option. Also, is it true that the uterus, the child shares blood with the mother? That's on Instagram. They're asking.
Say that again?
Is it true that in utero,
the
child shares blood with the mother?
No, not at all. The blood gets exchanged at the placental interface between the baby and the mother. So things like sugar and some antibodies and oxygen and stuff pass by. But if mom and baby exchange blood, it's actually an unholy disaster. So I'm still paying off the loan from the adoption of a baby I don't have. That's sad. See, that's a problem. I think we get 2-3 chances at IVF first on the NHS, so it's a lot cheaper than adoption.
Wow.
There was a comment above that too. Yeah. That's incredible.
You have also questions not related to the subject whenever you're ready.
Yeah, I'm ready. That was
gears.
a good talk. Yeah, okay, well, thank you for your input, everybody. There wasn't a great article to review, but I wanted to see what your thoughts were on that. And certainly if you have more ideas, we'll post that in our blog on the website, which is going to be up and running hopefully very soon. So I'm going to make Tarek have that ready for tomorrow or the day after, I hope.
Yeah, 100%.
And put that up on the blog, and we'll get people to can we create a, like, can people write in on the blog?
You don't want that.
Yeah, we do want that.
We want that?
Yeah. Let people comment.
All right, we'll do that.
Yeah. So put your comments on our website, www.drvictory.com. It'll be up in a day or so. Yeah.
All right,
fire away.
So for the new people watching on TikTok, I think it's important that you introduce the show at this segment.
Sure. So our show is called Fertility Fact or Fiction, if you just joined us. I am Dr. Rahi Victory, a reproductive endocrinology and infertility specialist. I am board certified in the US and Canada, and I am trying to get my board certification in the UK as well, because we want to open up an office in the UK. So, yeah, that's us.
There you go. Hello, Dream Team.
Dream Team. I like Dream Team. Dream Team is always a favorite, right?
I will never say no to that.
Yeah.
I'm 32 and I have one live pregnancy, 2 miscarriages, and 1 ectopic.
Okay.
Would you recommend genetic testing of embryos if in IVF, or would I still have a good chance without it?
So at 32, most studies will show you that the rate of genetically normal embryos will probably be somewhere between 30 to 40%. So most people are not advocating for doing genetic testing at that age because there's no proven benefit to doing so. So I can't tell you what to do. I can just give you statistics and tell you what the studies show. There are experts that advocate everybody should be doing it. I don't agree with that approach. But certainly the data is suggesting much more value in doing it when you're over the age of 35 or 38, depending on which study you read.
Week 7, no heartbeat at viability scan, and embryos a week behind, 5 weeks and 6 days. Can we have any chance with pregnancy progression?
It's possible, but that's a very low likelihood, unfortunately. Yeah, I'm really sorry, guys. Whoever that is, my heart goes out to you, but it's unlikely that would result in a normal outcome.
Hello, Dream Team.
Again.
Excellent.
We are the Dream Team.
Dr. V, I had 2 early miscarriages. Do you recommend taking low-dose aspirin on early days of pregnancy, even if it's not IVF?
So I can't give patient-specific recommendations on social media. However, I will say that we have a whole video on aspirin, and there are many, many benefits to taking aspirin. The studies have not proven a direct benefit for reduction in miscarriage in every study, but there are studies that have. And I actually reviewed that in a talk I gave recently. So there are studies that show that there is a reduction in miscarriages when you're taking baby aspirin. In my opinion, the timing is everything. It has to be done before you even get pregnant. If you take it after you've found out you're pregnant, it's too late. Because the whole reason that there are complications is during the initial phase where the embryo is implanting, and it has a lot to do with thromboxane and prostacyclin, which are chemicals that are very important in the establishment of the placental tissue. So if you can start before, you're going to alter that balance, and that can be critical to success and failure. If you're starting it after, the major functional components that need to be there are already there. You cannot alter those with aspirin. So it has to be done at the right time.
Doctors in the UK recommend waiting 12 months for fertility tests. Would you recommend earlier?
I like you on the TikTok over there. This is a first for us. Tarek is now the moderator, so he gets the questions first. Yeah, so it's age-based, right? So in North America, we don't do it strictly based on the year or the time. So if you're under 35 and your periods are regular, a year is reasonable, but it depends on what's going on and your family history and stuff like that. So everybody's different. Your sister had premature ovarian failure at 37, you're 35, you should be seen right away. Like, don't even wait, go get checked out. But if everything in the family history is normal, you're less than 35, a year of trying with regular periods, reasonable. 35 to like 37, 38, most programs will recommend 6 months, or even 35 to kind of, 40. And then above 38, 39, 40, they'll recommend just 3 months, and then you should see a fertility specialist because of the decrease in success. Those are all predicated on your period being regular, meaning 21 to 35 days interval from period to period. If your period is irregular, you have to see a doctor right away because that's a cancer risk. So make sure you're always seeing a doctor if your periods are irregular, because either your ovaries are not working properly or they're beginning to fail, and either way that's not safe. So go get checked out and make sure. Yeah.
Would you ever allow a patient to do an FET while still breastfeeding? Why do clinics give blanket no statements for this?
Because high prolactin levels interfere with your estrogen levels, and they interfere with your lining, and so it does make it much more difficult to get pregnant. It doesn't make it impossible, but it does make it more difficult, and you're on kind of what I like to call relative birth control. So that's not a good idea at all. We would never advocate for that. What is my opinion regarding the nub theory? I don't even know what the nub theory is. I've never heard of that before.
I don't know it.
I don't know the nub theory. Tell me what the nub theory is, Heather, and I will happily try and advise you.
Can you take turmeric supplements during pregnancy?
Yes.
Hello, Fantastic 2.
Oh, that's a new one.
That's a new one for sure.
That is a new one. Points for creativity to whoever said that.
What is the ideal prog level in picomoles for implantation? Maximum, minimum thresholds. Thank you for all the knowledge you share. You're incredible. Love you, Doc, and love you, Tart.
Picomoles? Oh,
Picomoles.
wow. Okay, so we use nanomoles, not picomoles. I think you probably mean nanomoles. 40 to 100 for non-endo patients, 150 for endo patients. Yeah. Heather's got to tell us what nub theory is. Now
I'm super curious.
And I can't look it up because you've got...
Yeah. Oh, yeah. We got screens everywhere here.
Yeah.
Hey, Dr. V&T.
Yeah.
Wonder if stevia sweetener is safe for male fertility.
Yes, as far as we know it is. Yeah. Stevia is actually pretty, low-key.
What do you think of LDN for those who have autoimmune disease trying to convince or currently doing IVF?
So trying to conceive or currently doing IVF? You said convince.
I just read, convince. It's conceive for sure, logically speaking.
So, low dose naltrexone, which is LDN. I'm not convinced by the data. There's a few studies, they're kind of hocus pocus. Some of them suggest the benefit, some don't. I'm not convinced at all. I think we need more data first. So if I see a big study that looks really robust, maybe. But aside from that, no.
Can scarring from surgery for endometriosis make pregnancy more uncomfortable?
Oh, great question. In general, scarring in pregnancy does not cause a lot of pain. In general, I'm sure there are many women out there that will disagree with me, and I'm not questioning that. I'm sure some women suffer greatly, but in general, it does not hurt as much, both the scarring and the endo itself. So pain tends to get abated quite a bit when you're pregnant, and that's very helpful. Katie and Heather have become...
They're besties.
Besties on her TikTok. That's
nice.
Really cute. I love the fact that people are socializing together. It's nice.
How's that? I think it would be me.
We help people make friends.
That's easy things.
39, DOR with poor egg quality. Does human growth hormone with egg quality? So human growth hormone can increase the number of eggs you produce and increase the number of blastocysts that you get. Whether or not it improves live birth is questionable. There are some studies that say yes, most say no, but you do get more blastocysts and more good quality blastocysts. Yeah. Does polyp removal increase chances of an FET being successful? So I was just part of a symposium by the drug company Ferring, and one of the talks was on surgery. And I love the person that gave the talk, but I have to respectfully say I disagree with what they said. Polyps have been proven to increase failure rates and miscarriage rates, and no one in their right mind would transfer embryos into a uterus full of polyps. So we always remove polyps and fibroids that are inside the cavity of the uterus before we do transfers. That's a good question. Yeah, that was from Little Angel 45.
There you go.
Little.
Can I do a FET right after I failed FET, please?
Yes. That's an easy one. That was a gimme. We never get those.
Going through all the questions. So okay, here we go. Hey, Dr. V, question.
Yeah.
If Menopur and Pregverse did not work to get a follicle to grow, is there a chance they can work when doing IVF in higher dose?
A chance, yes, it's possible. It is possible. Yeah. So we missed a question on TikTok.
I can read it to you about the nub.
About the nub, yeah, because and there was one above that. Too.
Yeah, folic acid.
Yeah. So, any other supplements?
Yeah, any other. So I take folic acid for the start of my conception journey. Anything else you recommend?
Yeah. So vitamin D, iron, folic acid, melatonin, and the omega-3s have all been shown to be beneficial. So we recommend all of those. Yeah, and then the nub is the angle of dangle. I know what that is. So the nub theory is
angle of dangle.
Yeah, Paulina, our ultrasound tech, believes in this. We're actually going to try doing a research study on it. So there are people that think that on the 13-week ultrasound they can detect whether it's a boy or not, which I find interesting because it doesn't even develop till about 17 weeks. But our ultrasound tech says that there's some angle she can detect and that it's like 100% correct. So we're going to run a trial to see if that's true or not, and figure it out. But yeah, at the moment, no one has proven anything interesting about the nub theory there. Yeah.
So I'm brand new to IVF world and I'm doing all the things. We have our post-testing appointment next week.
Great. Yeah. Do all the vitamins, do all the supplements, wait for your review, and then figure out what's wrong and whether or not you even need IVF. One of my biggest gripes, and I got a lot of this at the Canadian Fertility Show, all these people that were rushed into IVF, half of them don't even need it. Listen, IVF can be a very useful tool, but it's a tool. And I've said this before on the show, I probably haven't said it for a long time, but if you're using a hammer to, like put on a paper clip, like that's insane. You don't need to do that. Sometimes there's really easy things in it. You don't need a sledgehammer to put in a tiny little pin or a thumbtack. Sometimes you can just gently apply the thumbtack. So sometimes you can get away with vitamins and supplements. Sometimes you need insemination. Sometimes you need to stop bad habits or improve your lifestyle. And other times, yes, you need IVF. But IVF is only a tool that should only be used when it's indicated or necessary. Not a tool that is just blanket applied to everyone so that the fertility specialist can make more money. And these days, it's not even the fertility specialist making more money. It's some company that either bought or invested into the fertility program, which I am woefully against. And they're the ones that are making all the money and making half of the clinical decisions. Do you know who owns your fertility center? Is it owned in part by venture capital or some conglomerate? Or did one group buy up a bunch of other fertility centers and now tell them to change things? If they did, you got to ask whether or not you're getting the best care, because chances are you're not.
This is unrelated question to what we were previously talking about.
That would be a good topic for next time at the start of the show.
I saw that.
Let's
I liked
do
it.
that. Yeah, actually.
What are some reasons why someone would under-response to FSH injections at 250 units a day with very little follicle growth after Lupron?
Well, if you took microdose Lupron, that's a different question. If you took suppressive Lupron and you had weak ovaries, it'll shut you down. So that's a long agonist protocol. Doesn't always work well. It's certainly not for everybody, so that's something you need to factor in. And then the other part of it is, all the other elements that go into it. What is your body mass index? These drugs are, divided into your adipose tissue. So if you are heavier, you need more. Or on the flip side, if you are really thin, did you have enough adipose tissue? So there are people who are hormonally stressed, whose thyroid is not in balance, who have high prolactin levels. They didn't take the shot correctly. I mean, there's all sorts of different reasons. Lupron was too strong. They were on it for too long. There's a lot of different reasons why a medication won't work.
A lot of people I know say they got pregnant when they stopped trying or stressing about pregnancy.
Yeah, there probably is something to that. It's probably hormonal, and it is true that a lot of people, and I'm not telling people to go de-stress because people hate it when you tell them to go de-stress, but there is definitely a trend that we see where people, even who just come to see us, get pregnant while they're going through their testing, probably because they feel comfortable now that something's going to happen, they're going to get some answers. It relieves some of the pressure. It probably reduces your cortisol levels, and maybe that just makes things work better. I don't know. But we do see it out there for sure. No one knows the mechanism behind it. Somebody asked about pre-seed as well.
Yeah.
Pre-seed is a special type of lubricant which has been proven to minimize the impact on sperm, and it does actually minimize the impact on sperm. So if you're going to use lubricant while trying to conceive, pre-seed is very reasonable. It's super expensive, but it does work well. And by contrast, all the other lubricants are actually relatively spermicidal. So keep that in mind, including saliva.
Spermicidal, eh?
Oh, yeah. Yeah.
Oh. I feel like it's an interesting option. This is so amazing. Hi, Dr. VNT. For an endo patient who had surgery to remove it in January and wants to do IUI, would you recommend medicated or natural, or does it depend?
Well, I would need a consult for you. Did we lose something?
Yeah, he lost something.
Oh, the battery died?
Battery was on all day. Bear with us.
No worries. So we've got audio only, but we'll have camera in a minute. Should I pull this over?
Oh, that's good. Oh, yeah. Oh, I'll tell you what to do. I don't know yet.
You're going to need me to pull it over. You just have to keep it out of the view of TikTok. So I can see that, though. There you go. How's that? So, yeah. I just got distracted there. What was the question again?
I don't know. You gotta bear with me here. Okay, you're good.
Yeah. Sorry, folks. We jumped off. I'm on both of these.
Major angle here. Yeah. Okay.
Yeah. So what was the question?
Yeah, that's right. So yeah. Okay. That was unexpected. Should have expected when you really think about it. What was the question?
I lost it because I was moving.
Hi, Dr. Vinti. For endo patients who had surgery to remove it in January.
Yeah.
And wants to do IUI, would you recommend medicated or natural, or does it?
Sorry about that. So it depends, and I would need to kind of talk to you and see exactly what's going on. In some instances, it's reasonable to do medicated, and in other instances, it is not reasonable to do medicated. So it would very much depend on kind of what you wanted to do and how you wanted to do it and all that stuff. So it very much depends on what you think, what your RE thinks of your actual sort of whole story. I can't tell you just one thing is perfect. Yeah, it's not one size fits all for sure. No cookie cutter medicine.
Thoughts on superfact as a prime before stims?
As a prime? Microdose superfact might work. We're about to try because we lost microdose Lupron. So that's a reasonable question. Nurse said that after contraceptive implant is removed, pregnancy can happen immediately. Is it true? It can, but in general, it takes 3 to 6 months to resume. So it takes a while to go back to normal.
Dr. V, question. If minoprogonolef and Proveris, I think I read that right?
No.
No? I feel like I read Proveris. Did not work to get a follicle to grow. Is there a chance they can work when doing IVF in a higher dose? I didn't read that to you?
Oh, maybe you did. Yeah, there's a chance, but like I said, it depends on what was wrong. So you got to find out what was wrong. And it depends on your ovaries. If you're in menopause, higher dose isn't necessarily going to work.
Do type 2 diabetic medications such as metformin and insulin have an impact on male fertility?
Definitely. Male diabetics have lousy sperm a lot of the time, so that can have a very significant impact, for sure.
What do you think of LDN for those who have autoimmune disease?
That one you asked.
I did that?
Yeah, they asked that already.
Okay.
Yeah.
Recently started testing with your clinic and found naturally high protein levels. Wondering what can cause this.
Naturally high protein levels?
Prolactin levels.
Oh.
Sorry. My bad.
Yeah, high prolactin levels usually come from a enlargement of your pituitary gland in the portion of it in the anterior pituitary where you produce prolactin, and when it gets enlarged, and we don't know why it gets enlarged, then you start producing more prolactin. So that's typically the main reason why. Other things would be chest trauma, frequent nipple stimulation, that kind of thing.
Can high levels of estrogen prior to an FET cause issues with implantation or cause chemical pregnancy?
Yeah, there are some studies that show that high levels of estrogen are detrimental to implantation, which is why we don't use the estrogen progesterone protocols anymore, the HRT protocols. I have a patient I dealt with recently who, without getting into too much specifics for privacy reasons, almost died from their FET protocol. Not my patient. I was taking care of somebody else's patient from another clinic. But this individual almost died from their protocol, and they were on super high doses, and there was a whole bunch of other stuff going on. So I think you need to be very cautious when you're using an estrogen-based protocol, because that estrogen is detrimental for a variety of reasons. What is a chemical pregnancy? Heard about it, but don't know the science behind it. A chemical pregnancy is when you have an implantation from IUI or IVF or natural, and the hormone level for the beta HCG starts to rise, but it never gets high enough for you to see a baby. And so there's a miscarriage that occurs before you even get to being able to see something on ultrasound. So you only saw chemical evidence of the pregnancy. What causes it? There's a million things that cause it. Most likely problem is probably genetics of the embryo, but we don't always know.
When is DNA fragmentation indicated? Husband's SA is normal. All my labs are normal, but having a hard time making blasts.
Oh, I would definitely do it. I mean, I believe more and more that everybody should be getting DNA fragmentation. So I'm a believer that it's a valuable test, and we should be doing it for everyone. Yeah. Having said that, definitely if there's smoking, drinking, drug use, multiple failures, if you're having trouble getting blasts, you probably need a consult with someone who's really good at fertility, so they can kind of run through all the things with you and explain it all to you.
Hello, Victory Team. REI is recommending Menopur 375 and letrozole for 37-year-old with adeno. Does this seem good? I'm worried about making my adeno worse.
No, that's very high dose, and Menopur, I've never heard of anyone using 375 units of pure Menopur. That's probably a lot of HCG. It'll make a lot of your smaller follicles die. So I would not be doing 375 of Menopur personally, but you got to talk to your REI and see what their experience is. We actually will likely start decreasing our Menopur or limiting our Menopur exposure to a specific upper limit soon, because I'm not sure when we use those higher doses, it's a great idea. So we already are capping at usually 187.5, occasionally 225. I think I'm probably going to cap it around 150.
Urgent.
Oh.
Dr. Victory.
Yeah.
How amazing are you?
Oh, wow. That's
Please
not
elaborate on this.
Yeah.
Lots of positive vibes and best regards from Fertility in Greece.
Oh, well, thank you, Fertility in Greece. Why are they awake at this hour?
They're watching your show, man.
That's like 2 in the morning. No, that's not. That's 4 in the morning in Greece.
People wake up for this show, man. People wake up for this.
Tarek is very pleased. Well, thank you, Fertility, for watching. I'm sorry you're awake at this ungodly hour of the morning. That's crazy. Unless you guys are at the conference you were talking about. Thank you for the urgent message. We think you're amazing too. We love the work you guys do. So thank you for saying hello.
on TikTok. Not a question, just want to thank you so much for answering. It's very kind of you.
My pleasure. Did you see the one from Heather right above that?
I've heard that it's the male side that determines the gender. Is that true?
That is 100% true. So women only have X chromosomes, so you can only produce a female. But men have X and Y chromosomes. So if the Y goes to the baby, then you have a boy. And if an X goes to the baby, you have a girl. So it is actually the male side that determines the sex. Yeah. Not that we're any good at choosing, but it is our side that determines
I don't
it.
choose.
Yeah, I don't choose any. I don't choose anything in my house. Do you?
No. I'm thinking maybe I can choose a car. I'm kind of feeling like
Oh, well, Kark and I had to go car shopping because he had an unfortunate car incident in his family today. But I'm helping a brother out, so we'll see. And speaking of Tarek and I, we ate, for those of you that are local here and watching from Windsor, Tarek said we should try Yemenis food tonight. And so is it Yemeni food from Yemen. So we tried a place called Yemen Stars.
Yeah, I think so.
Yemen Stars,
yeah,
right?
I think so.
Holy cow, is that good food? Including multiple meals, the names of which I can't pronounce despite being Middle Eastern. But the food was incredible. It was so good. The guy that brought it to us was actually the manager. Nicest guy I think I've ever met.
Oh yeah, he did us a solid.
He did do us a solid. And then he offered us this amazing dessert that I tried. I had no idea what he was describing when he described it. Honestly, one of the best desserts I've ever had. So if you're local in town, please go try them. They were phenomenal. This is not a paid advertisement. We didn't get the food for free or anything like that, but the food was amazing. It was so good. We loved it. Yeah, go try it out.
Hello, Dynamic Duo.
Yeah.
What are the next steps if Menopur 225 and Gonal-F 225 didn't stimulate follicular growth in my IVF cycle? How does an IVF follicular cycle work? Tract ovu, then start Sims.
Yeah, I mean, if that didn't work, they got to figure out why. Were you on birth control first? Is there a hormonal problem? Are your ovaries just really weak? Suggestions would be things like microdose flare, DHEA, testosterone priming, human growth hormone priming, PRP, which we're doing in the clinic now. So there's a whole bunch of different approaches that you can use. It's just a matter of how you do it.
The NHS is a mess now, and I feel bad booking an appointment to ask these questions. You are a savior.
Aw, thank you.
Savior.
We're the NHS antidote.
Yeah. They just messed me up a little bit.
They do. I mean, I'm impressed. These ladies are up at 1 in the morning.
It's interesting. We're having a conversation today about how far do people...
about how far people... Yeah, our farthest was Australia, I think. We got to get someone from like even farther, Antarctica or something.
It's just a goal, man. We can do it. We can do it.
it.
What are some reasons why someone would be under-responsive to high doses of FSH Gonal 250?
I think we've answered that. Yeah, several times. Yeah.
What is a good heart rate for a pregnancy measuring 8 weeks?
130, 140. Anywhere that would be a good heart rate, but anywhere from about 110 to 170 we would accept.
Hi, how long is wait for appointment with you?
It depends on the urgency, so it's a hard question to answer because if there's something emergent like cancer, I see people the same day, literally the same day. If it's not an emergency, it's a lot longer, sometimes a month or two. And it also depends if you want to start with me or you're willing to start with one of my colleagues and then get to me eventually, because everybody does get to me, but sometimes I have somebody else take your history and get the test started. So
sometimes I show up in the room.
Sometimes, no. Not yet. We haven't gone that far yet. Have I seen success with 3 BB day 5 embryos? A 3 BB day 5 embryo is a great embryo. Of course we have. Yeah. Ooh, great question from Jess Chubinville. Do you see that one?
Yes, you're on here right now. Okay.
So for those of you who are thinking of donating embryos, first of all, my hat's off to you. We love you. That's an amazing thing to do and phenomenal gift to humanity. So I love that. I think that's great. And if you are thinking of doing that, you can specify what you want us to do with them. We can isolate them for people here. We can isolate them for people not here. You can say, out of the country, out of the continent, only in the city, whatever you want. We can do, pretty much what you like.
The call for the show, people really want to get pregnant. I'll do that one as well.
Yeah.
What is a late period? Normally, I'm a 29-day cycle, but recently went up to 35. Is this normal?
Yeah, 35 is the upper limit, so that's as far as you get to go. Yeah.
You donate the embryos. Okay, back to Instagram. How can someone in Alberta become your patient, please?
We got loads of Albertans.
I've been doing IVF, and I still don't know what the problem is that I have.
Okay, so you shouldn't be doing IVF if you don't know what the problem that you have is. This is Instagram. I'm looking at the wrong camera. We got too much action.
There's a lot of action. A lot of action.
So if you're doing IVF and you don't know what the problem is, then you need a better fertility center. Now, that's not to say we have an answer every time. I do tell people you're unexplained. And as long as they told you that's your problem, you are unexplained, then at least you have an answer. But it is not reasonable to not know what your diagnosis is. I am vehemently opposed to that. So definitely just contact our clinic, and we do loads of patients from Alberta, a lot. In fact, we just had a patient recently who had seen multiple clinics in Alberta, none of which could help her, and then she came to us just to thicken her lining. We got her lining thickened, we transferred her embryo here, she got pregnant, went back first try. It was easy. So there's lots of things we can do to help you out. Not a problem.
Should you stop melatonin after transfer or continue it?
Nope, just stay on. It helps you sleep. No risks. It's fine.
If your patients have confirmed endo and recent endo excised, do you still put them on 3 months DL plus letrozole suppression protocol before FET? Can 2 months suppression be sufficient? Yeah,
somebody shared a study with me recently that said 2 months was the same. I'm going to stick with 3 because all the Lupron and endo studies were 3 minimum or 6. But this study said 2 was enough, so maybe 2 is okay. Yeah.
How early do most twin moms go into labor? Do you think a month, 2 months? What's your average?
Oh, well, a substantial portion. The average delivery time for twins is 37 weeks. So a lot of them, are going, if that's average, just imagine that 50% are delivering past it, but 50% are delivering before. So there's a lot that are delivering earlier. Yeah. Katie is asking what clinic I'm affiliated with. We are Victory Reproductive Care. So it's named after my family name because everybody said it's a good name to have on a fertility clinic, and we went with it for better or for worse. So yeah, by all means, let me know if we can help you, and we will help you out.
Do you see a high success rate from endo patients?
If they follow our protocol, we've got it to the point where it's almost the same as normal. It's not quite as good, but it's very, very close. Yeah.
Do you recommend Recavell over Gonal-F for IVF?
I think Recavell is a great drug and it has some benefits, and we are trying it out in various patient populations to see where we think it would be better or worse than Gonal-F. I think they are both fantastic drugs. I'm currently using them in kind of different populations. I don't want to, stick my foot in my mouth without knowing more about whether or not one is better than another in specific populations, but it does work quite well. Yeah. Oh, great question on TikTok. Do I think cesarean is the best decision for twins? So I love obstetrical questions. So the question is, are cesarean sections indicated for twins? And the answer is, it is still safer to deliver your twin babies by doing a vaginal delivery of both twins, as long as the first one is head down, and ideally the second one is head down, or you have a really good OB who's comfortable doing the first one head down and then doing what's called a breech extraction for the second one, where we literally reach all the way in, find the baby's feet, and we pull the baby out feet first. So that works very, very well. I do it all the time. I'm very comfortable doing that. Most of us are. And so that's a safer approach for you and for babies than to deliver vaginally. By cesarean. Cesarean section must be done if the first baby is breech. You cannot deliver twins vaginally if the first baby is breech. It is not safe because their heads can lock against one another at the chin, and that's deadly. So you can't do that. Yeah.
That's interesting.
Yeah, it's
That's
scary.
the technique, eh?
Yeah. It's called locked twins. It's
locked twins. Wow. I stopped nursing in order to get my period back for FET. It took 6 weeks. I then did 2 back-to-back FETs. Ever since my cycles are 37 days. I don't ovulate till day 23. Is this a concern?
It's a long time to be exposed to estrogen by your body, so I'm not sure that that's ideal. We definitely like it shorter where possible. So yeah, I would probably want to relook at that. Could I what is it? Heather saying something on thing? Can you see that?
Yeah, I can see the one before it. Yeah.
Okay.
If you want to read,
Yeah.
read that right
Yeah.
now?
Yeah. Sure.
Okay. I'm 24 weeks and I was told that I have a low hormone in my placenta, which could affect the growth. Could you explain? I've gotten no explanation.
I've never heard of a low hormone in your placenta that can affect the growth. The flow of blood through the placenta can affect the growth, but not low hormones per se, unless they're talking about human placental lactogen. But that's not something we frequently look at, and I've never seen it measured before. So IUGR can be caused by placental dysfunction, but we don't measure hormone levels to assess growth. Yeah.
Good answer.
Never heard of that one.
UK.
It is a little unusual out there.
His Majesty. This guy.
Some stuff that's different.
I'm hoping to go over patients. Is it possible to do start my care, labs, blood work, etc. here in Seattle, or do all appointments need to be at your clinic?
Oh no, we have people doing their monitoring all over the world, and then they just come to us for retrieval and transfer. I had one recently from Australia. We've got one from the UK. I've had several. I've got one that's come 3 times from Italy. She actually did fantastic with us. We had a patient who just came in today from Ohio. She tried 6 times before to get to the same place she did in 2 tries with us. So we do a great job. There's no question. And you don't need to come here for every single appointment. I mean, if you're local, it's great. But if you're not local, then don't worry about it. Tal's ready to come and visit us.
I see that. She's so ready.
Unless she's talking to Heather or Katie, who they all made friends with. So now I'm not sure who they're directing it to.
It's you, man. It's got to be to you.
I hope it's.
That's how I read it.
Yeah. Yeah. If you guys are getting together for a holiday, Tarek and I are happily willing to come join for a holiday. Yeah.
We love holidays.
We can talk about fertility. We'll do some Instagram. It'll be fun.
I'm in West Virginia. That's so far away.
That's not far away at all. I'm telling you, we literally had someone come from Australia. If you're in West Virginia, you're a 2-hour flight away from us.
That's 2.5 hours. Hop, skip, and a jump, as they say.
That's literally a hop, skip, and a jump. Fly to Detroit. We're 20 minutes from the Detroit border. It's easy getting here.
That's important. And
it's 1/3 the cost. So factor that in, and it's well worth the time and effort. Yeah.
I was hoping to go hold on. I read that. Is late ovulation anywhere between CD 18 to 28 something that could indicate a problem?
Yes, and egg quality starts to get compromised when it's that far out. So you should definitely see that.
Is resveratrol safe after transfer? I see. I should stop. I have endo. If I see it, should I stop? I have endo.
No, you can stay on resveratrol. There's no harm, and it's good for your endo. Why did I choose this specialization?
Oh, that's the.
I love that question. So OBGYN is the most dynamic thing you can do in medicine. There's lots of emergencies. There's lots of crashes. There's lots of women who and babies that are in need of very emergent, quick thinking care. And I love that. I'm a bit of an action junkie, hence all the cars behind me here. It's super diverse. So I get to do obstetrics. I get to do gynecology. I get to do a little bit of primary care medicine. I get to do full surgery, and I love the surgery, like minimally invasive surgery is a huge passion for me. I get to make babies, which is super fun for people. And then we get to do radiology as well, and then emergency stuff too. So it's more than you get to do in any other field. We're doing medicine, we're doing primary care, we're doing surgery. Like you're literally kind of all of the medicine specialties all wrapped up in one. I think it's so cool, and I never get bored or tired. And I love being active and doing things and learning all the time. So I learn something every day. It's an awesome life. It's busy. I have a saint of a wife. Huge round of applause and shout outs to @Wendever. It's _Wendever _. If you want to torture her, bombard her with lots of thank you for giving up your husband to us today. But Wendy is an amazing woman. My kids too, who have put up with me building this life. But we get to help loads of people. It's pretty cool.
Do you recommend Fertility or Maternal for inflammation and microbiome testing?
Fertility, I don't use Maternal at all, so my recommendation is definitely Fertility.
How do you book an appointment with you, and how long is the wait?
Contact info@drvictory.com. Just tell them that you want to consult with me, and we will arrange to see you. The wait is triaged based on the urgency. So, if you're 42 and your ovaries are weak, you're going to get seen sooner than if you're 26 and you have PCOS. I mean, there are urgencies that we need to deal with sometimes. Jess Jubenville asked if we should change her due date. No, it has to be out by about a week and a half at that stage of the pregnancy for us to change her due date. 4 days is not enough. Yeah, it says she was 12 weeks, 4 days.
Yeah, that's right.
Yeah.
Seen your video on ALA. Is it a good idea to start taking it pre-retrieval?
Yeah, I'm putting everybody on ALA now. Like that really looks like a potent something. I'm very grateful to whoever it was who mentioned it to us on the show. That's right. Because I started doing a lot of research on it, and sure enough, it is amazingly potent. So
903, yeah.
903.
Last question on TikTok. We'll end it on that.
Sounds
Does
good.
having no periods when on implant contraception affect conception once it's removed?
Nope, not at all. You just have to wait a couple months till your period comes back. Anything else on the other ones?
I think we're caught up on Instagram.
Oh wow.
I think Facebook obviously is okay. YouTube's okay. We're all okay here.
Excellent. We're done. All right, guys. My apologies to Christina Bruculeri, who just joined us. We're actually going off the air now. Thank you so much for a great show. Appreciate your input. Next week, maybe
one more.
Right.
It seems important.
All right.
Been in the hospital for vomiting for 48 hours.
Oh.
Extremely dehydrated to the level where they poked me 5 times. If it worked the 6 times, 13 weeks along.
Yeah.
What do you recommend?
IV hydration, Maxaran, Zofran, Gravol, acid blockers like pantoprazole, ranitidine, and see when your stomach settles, and then diclectin for maintenance. That's in any guideline on hyperemesis.
What about domperidone or something like that? What was that called?
No.
No, not for that? My wife was on domperidone all the time.
Because of hyperemesis?
Yeah, she was just a mess.
Domperidone is just for gut motility.
Uh-huh.
So if it's like stuck, you can use it, but it's not for hyperemesis.
Oh, she had everything.
Wow.
Yeah.
That's crazy. All right, guys. Thank you so much for joining us on Fertility Fact or Fiction. Next week, maybe if we can't find a good paper, we will have the other discussion. What was the other discussion? I've already forgotten. Discussion.
I'll scroll back and get it.
Yeah, we'll scroll back and get it. But we'll talk about, whether or not you guys think it's okay for big businesses, venture capital, private equity investors to own fertility companies, or whether it should be owned and operated solely by physicians. Let's talk about that, because it's a big thing in the fertility world, and I know where I stand on it, but I'm super keen to find out where you guys stand on it. So join us next week, and we will have that chat. See you again next week on Fertility Fact or Fiction. As always, much love to my amazing partner in crime, Mr. Tarek Ibrahim from Ibrahim Strategies Group, who does all of the social media wizardry including not using a fresh battery in our camera this time.
That's perfect.
But he did manage to make it through the show with a very full tummy after a dinner. So well done. I'm impressed you stayed awake after that, man.
I've been working.
I know. All right. Have a good night, guys. We'll see you.